Hi, I'm Dr. Nikhil Pooviah, co-founder of Elly. We're helping life science companies support chronic disease patients. This is Kiara. Unfortunately, she was diagnosed with breast cancer and needs treatments from life science companies. This has left her anxious, overwhelmed, and lonely. When she needs comfort and support, she turns to Elly. Kiara starts by opening her iPhone app and listens to her daily Elly.
Hi, it's Elly. You are planting seeds for personal growth today. Look after them and they will continue to bloom.
Kiara can also watch exercise videos from instructors living with chronic conditions who understand her limitations. Then Kiara can listen to meditations from Alex, who had cancer as a young adult.
Each day, we'll come together to explore a fresh topic so that we can approach our day with a new way of thought, and then we'll meditate together.
Kiara can then dive into over 2,000 patient stories, so she can learn from over 100 patients like Ariana.
For me, staying mentally healthy and implementing self-love first came from acceptance.
Kiara can also check in with Elly to record her emotions and her symptoms. Overall, with Elly, Kiara feels significantly healthier and happier. Patients who spend just 30 days with Elly improve their quality of life on average by 15%. This is a result that no other product or trial has ever achieved. Elly also increases treatment adherence by 40%, which is compelling for pharma as they miss out on significant revenue from non-adherence. So we license B2B to pharma by selling data and content experiences. For our data license, customers like J&J pay us $50 per patient per year, and we give their oncology team insights on when patients have side effects. Directors like Roni value working with us as patients stay on treatments for longer, meaning her team increases their drug revenue targets. For our content license, customers like BMS pay us $5K per brand per month, and we give their patients custom audio content for drugs like Eliquis. Managers like Triff love that Elly reminds patients to take Eliquis each day. Because they're more compliant, he's already lining up other drugs in their portfolio that we plan to upsell into. I've spent 10 years looking after patients as a physician, so I've seen firsthand a lot of the pain points that our users and their families go through. And as an investor myself, I value the importance of finding product market fit, which is why we've been focused on growing revenue with our key offerings. Since our launch, we've already hit $240,000 in revenue with a further $1 million ARR in our pipeline. We've achieved these milestones working with some great customers, and we're supporting over 11,000 users. They listen on average to 190 minutes of total Elly content. As we sign up new customers, we plan to upsell across 50 chronic conditions and address a total obtainable market of $100 million conservatively within the next 3 years. Unlike competitors, our app has a rich audio experience, content on patient education, and better accessibility. I'm joined by my co-founders, Cecilia and Simon. Our previous startups are currently valued at over $250 million. We've sold to pharma in the past and know how to keep these sales cycles to under 4 months. For Elly, we're already backed by some reputable investors, including Google, Bayer, Snap, and Morgan Stanley. I'm Nick, co-founder of Elly. We're helping chronic disease patients live healthier and happier. And I look forward to your questions.
Thanks, Nick. All right, investors, David, you're up next, please. Question for Nick.
I love that you're trying to help this space. It sounds like you're monetizing, as you mentioned, through big pharma. It seems to me that it is tied to usage in terms of the pricing. So I'm curious, when you market it, how much of that heavy lift is on your shoulders versus the doctors versus the payers? And do you get access to who's on these different meds and on these different treatments?
All right, thank you, David. Pascal Unger.
Yeah, thank you. Selling to pharma is a good business, as I understand, but it only works if you actually have the user base. And so can you tell us a little bit more how you're thinking about acquiring all these users, especially given that the space for apps and mental wellness and well-being is incredibly crowded already, even though you're slightly differentiating yourself.
Thank you, Pascal. Pascal Dion.
Not a space I'm very familiar with, but I'm also very curious about the go-to-market on both sides, acquisition of customers and the pharma company.
All right, great. Let's try to grab one more. Alejandro.
Yeah, I have a question related to your business model. Have you thought about charging any kind of like success fee, taking on more economic risk reward if metrics improve, like drug yield or something like that? Thanks.
All right, terrific. Thanks for the questions. All right, you have 2 minutes. Nick, please.
Yeah, thanks for those questions, everyone. So I'll start first with David, which overlap with Pascal's questions. So on the kind of monetizing through pharma side, we actually receive marketing spend budget from some of the pharma customers we work with. So J&J actually gave us 50K to actually acquire patients on their behalf. So that's one way that we work with pharma. Another way is we can actually sign up patients through hospital partners that they have in place already. So there is a bit of a lift in terms of the onboarding, but it's quite simple if we can use digital channels like not just Apple Search, Facebook, Instagram, but also other channels like TikTok, Snapchat, and Reddit, which we've shown to be quite effective as well. Pascal, you asked about the user base and how we acquire our users. So we not just acquire users through our pharma partners, we also partner with a lot of hospitals. So some of the hospitals and health systems we partnered with include Cedars-Sinai, Duke, Oceana, and Cleveland Clinic. We basically give them digital brochures or physical brochures that they hand to their patients. And for us, that's a flywheel to better understand which drugs patients are on. So we can go to a Novartis and we can say, hey, we've got 10 of your patients taking this drug. Here's another way we can actually service them in a more personalized kind of manner. Pascal, you asked about the marketing strategy. So yes, we work with pharma and hospitals, like I mentioned. We also partner with nonprofits as well as our contributors who create content with us. So they in themselves are micro-influencers. So we basically give them a code, which they can then distribute to their own audiences. And then across with that, along with word of mouth, is how we've been acquiring users to date. Alejandra, I think, yeah, the pricing is still early days. We've got some early customers to date. I think over time, as you mentioned, having that adherence and tangible metric around the value of adherence over time is going to demonstrate and justify a stronger and higher pricing. We've started with this pricing because we've sold to pharma with budgets to date and in the past. But over time, you're right. We should be evolving this. Thanks for your questions, everyone.